Hi and welcome back to my channel. It is now about just a little over 2 weeks since my surgery. I thought I'd check in again just to update on how the last week went. Big things happened during the week in that I had both drains removed. However, in my last video I mentioned I was going in to get what I hoped was both drains removed, but the doctor's orders specified that only one drain could be removed at a time, so I was unable to get both of them taken out that day. I had to wait till my next appointment with the nurse at the clinic, which was 3 days later, to go in and have that second drain removed. So that was fine. It was a relief to have both drains out. It just gave me a little bit more flexibility, less anxiety about how I was moving, what was touching that area, worry about it being tugged, because each drain has a stitch around it that's attached to you, so if something tugs on it, then you feel it. So it was great having those taken out. The first drain, it actually hurt coming out. From what I've seen and heard, it's very, most of the time you don't feel it at all. So I was a little shocked when I felt pain, and I expressed that verbally during the removal of it. But yeah, it was just like a quick pull out, and it just felt like it was like tearing or like razor blade coming out of the opening where the drain was coming out. So didn't enjoy that. The second one though, I didn't feel a thing. The nurse took it out really slow, and I watched the whole thing. I'm like, cool looking, and when it came out, it was like not what I was expecting. It was actually like the base of the drain was like this kind of shape, and it had all the holes in it that it was just like absorbing the fluid. So I was like, wow, that came out of that little hole in the side of me. Damn. So yeah, that one I didn't feel anything, so that was great. So both drains removed. I still have a dressing under there, and actually went into see the nurse yesterday because I was having the staples removed, and the opening for the drains hasn't scabbed over yet, so they've dressed that, and hopefully in 3 days, she said, it would most likely be scabbed over, and that dressing can be removed. But yeah, as I mentioned, I got the staples removed. So that was an interesting experience. I didn't feel anything. Like, the staples coming out does not hurt at all. I did start to realize though that I'm not actually feeling anything. Like, I couldn't even feel her using the tool. Maybe she's just like super gentle. But I was like, I feel like I don't have much sensation in that area. You move up a little bit and it's very sore. I think it's still somewhat swollen. Not much bruising actually, but still quite sore in and around the area opposed to the actual area. However, I mean, like I was saying before when she would clean it, like that feeling of brushing against here, it feels so weird. It feels so weird. But that's a big milestone. The staples came out. There was 29 in total. And the wound stayed shut, so that's good. Right now I just have steri strips across, which was probably a little bit more of like an extra precaution. I could have probably walked out of there without any dressing or anything on there besides, where the drains came out. But when she's like, what would you like to do? I'm like, I don't know. What are we supposed to do? So she's like, I'll put them on just in case. So it's like strips all the way across, which will be interesting because when I had my biopsies done, they used steri strips over the biopsy points, and I actually got blisters from the steri strips. Now, I don't know if that's from like the adhesive specifically, like no matter what, when it touches me I get blisters, or what I think it is actually just, the movement of my then breast would create friction, and that was causing the blisters. So I'm hoping I'll be blister free and the steri strips will just fall off in a few days to a week, and then it heals on its own. It's going to make showering a lot easier. Showering with the drains was was fun. Used a lanyard, clipped them on over my neck, and just had them hanging there, and then just trying to like avoid this area. Like when I was finally able to like lift my arm enough and have, you know, enough space to get under there without like all of the packing of the dressing, and just like use a baby wipe to clean my underarm, it was like, oh. I was so happy. So yeah, so now I can like fully shower without worrying about getting this area wet. I'm allowed to, so that's going to make showering a lot easier. Pain-wise, it's just basically, it's not like pain, like chemo was way more painful. Like the Taxotere was a whole other level of pain. This is more of a discomfort with the occasional like lightning flash of sharp pain. I get it a lot like in the drain area, and then occasionally in this area. Mostly what I just feel is like pressure, like someone's like standing on my chest area all the time. And sometimes it's more, like it feels like it's getting its own little hot flash. And then there is what I call the phantom nipple pain, which I swear to God, it feels like my non-existent nipple has been rubbed raw by a shirt, and now like my shirt's touching it still. So I'll get that every once in a while, which is weird. Yeah, that's kind of like where I'm at with the surgery. I'm waiting to hear from my oncologist. She is actually supposed to be calling any minute now. I'm not sure if she's going to have my pathology report from surgery. I haven't heard anything yet on that. It's been 2 weeks, so maybe it takes longer than 2 weeks. But I'm really hoping that when she calls that she's going to have some of the information, if not all of the information, about my pathology from the surgery. So the 4 nodes they took out, the sliver of my pectoral muscle, and then the breast tissue. I'm really hoping that she'll be able to tell me today that I am considered cancer-free. But I won't know till she calls, and if she doesn't have that information, I'm hoping she can at least maybe tell me when I should be hearing about that, and if I'll be hearing it from her or from the surgeon. Because then in that case, I can call the surgeon's office and just ask, like, what's the ETA? Is there a general idea of when I'll be hearing how the surgery pathology went? Yeah, so that's kind of like the quick update of the last week. And next up we'll be talking to my oncologist. Definitely want to talk to her a bit about like what the plan moving forward is. I know a lot of that's dependent on the pathology, so if she doesn't have that, you know, we're still talking hypotheticals, but just also to let her know that I'm still having issues with my feet and my hands. Mostly my feet. My hands just kind of like every once in a while they get really like stiff and feel like arthritis-y. That's not a word, but my feet, if I dare to put on slippers or socks, let alone shoes, they are not happy. I've actually been having where I went out grocery shopping, and that was the first time I went out and walked for a while, outside of just like doing laps in my condo, and that night my feet were like on fire. The soles of my feet, like the heel and then the pads of the toes and the upper foot area were bright red. And after an Epsom salt soak, soaked them in the bathtub. An hour after that, they actually like calmed down and went back to regular non-red skin color. So I might just try and keep up with doing Epsom salt soaks. Hopefully that will help, but just wanted to mention that to her, that I'm still having issues with my hands and feet, as it's now 2 months out from chemo. Hoping that will go away eventually. Yeah, all right, well, next up is the phone call, which hopefully will come in on time. It's supposed to be at 11, and it is 10:58, so I'm hoping that I don't have to wait. She's usually quite prompt. Yeah, so I'm going to wait for that and hear the news, hopefully. It's 11:07, no phone call yet, waiting, but I just checked on my chart and my pathology report, I can't make that go in focus. My pathology report has just updated to be there. So I'm not going to look at it at this moment because I'm going to wait for the doctor to talk to me first, and then I'll look at it. But it's there. It's making me crazy. I just want to click on it. Well, at least I know then that she has it, which means when she calls, she will most likely talk to me about it. Because before this, I wasn't even sure if the pathology was in yet, so there was the chance that she would not have any information to share with me. So now I know it's there. Now I just need her to call, and it's 11:08. Hello, Catherine speaking.
Oh, hi, Catherine. It's Dr. Barua from Michael Garrett. Sorry for the delay.
That's okay.
I just wanted to call and get an update from you and also give you an update. So I see that you had your surgery on the 30th.
Yep.
Okay. And have you had a chance to speak to Dr. Sawira since then? Or?
No, not at all. Haven't heard anything.
Oh, okay. Well, I have good news. And very pleasantly surprising good news in that they actually didn't find any residual cancer in your surgical specimen.
Excellent. So that's lymph nodes, the pectoral muscle that they took out, and the tissue.
All of it, yeah. So I think perhaps whatever we were seeing on the ultrasound or even the MRI, sometimes it's just calcification, and they can't really. The only way they really know what something is to look at it through a microscope. And,
yeah.
It's really, and I remember you and I having the discussion that, we were kind of mentally preparing that maybe there might be something left and we would have to explore other, the possible pills afterwards.
Yeah.
But based on this, you don't need them, and, that's really good. That, it's not only good for, you not needing the pills, but it's a sign that your cancer really responds to the chemo, and, and not only in the breast, but, if in the worst case there were a few cells elsewhere, it would, there's a very good chance that they've been killed off. So that's very good and reassuring.
Okay. So is radiation, that's still on the table though, right?
That is unfortunately still part of the standard.
That's fine, understood.
Go through that. And you saw Dr. Vesprini, right?
Yes.
Okay, and have you reconnected with him since?
I have not. My understanding was we needed to have the surgery done and know the pathology and all that.
Right, of course. Okay, why don't I send him a quick email? He's normally very fast on email, and I'll let him know the surgery result and how you don't need any more chemo, and you can kind of move to the next step with him.
That's good.
Yeah, I know it's a lot, but I was thinking about you in the sense that that would kind of move up anything else that you know, in terms of pregnancy planning and so on. So
yeah,
it's really, it's a happy thing, and that all of what you had been through was worth it.
Yes, I don't even know what to say.
Yeah, I know, for sure. Okay, so from my point of view, I was just thinking, I actually don't need to see you for quite some time now.
I guess that is a question, is I move on to radiation, but then after radiation, what is my follow-up?
Right, so for after radiation, it's a kind of clinical follow-up every 6 months and a mammogram on the opposite side every year.
Okay.
So I guess I really only need to see you in about, I imagine that by the time I speak to Dr. Vesprini and he organizes radiation, that'll take place in the next month or so.
Yeah.
And then, so if I make an appointment for 6 months from now, you will have kind of recovered from your radiation, and, we'll count now as your time 0 type thing.
Okay.
So I'll see you again in 6 months, and then at that point I'll just kind of examine your breast, look at the, scar site, make sure the radiation. He'll speak to you about it, but may notice a little bit of skin change, and and so on, but nothing too major. And then I suspect Dr. Sawiras will want to see you too at some point.
Yeah, I have an appointment with him in around just under 3 weeks for a post-op checkup.
Right, yeah. Okay, perfect. Alrighty. Okay.
Thank
care.
you so
You're
much.
welcome. Okay, bye.
Okay, bye. Oh my god. I don't even know what to do right now. Whatever you I just don't even not even registering as real. I was trying so hard not to let my mind go to running through all the bad scenarios, because it's everything at Wellspring and everything was the way you think actually matters. So the last little bit, every time I would go negative, I'd be like, nope, and I'd just picture natural killer cells flowing around my body, just attacking anything.
Hello.
Hey,
What's up, Kathy?
I just got off the phone with Dr. Barua.
Yeah.
I'm totally cancer-free.
Oh, Kathy.
I didn't find anything.
You scared the hell out of
I
me.
know, I'm sorry. I'm my face just looks like this.
So happy. No, none in the lymph node.
Nothing. They couldn't find anything. She's
None in the muscle.
nope, she's pleasantly surprised actually that there was absolutely nothing.
Wow.
Yeah.
Oh my God. So what's next?
Radiation, but I don't have to do the oral chemo.
Oh, Kathy.
So that takes off 6 to 9 months of treatment.
Yes.
So
Yeah.
in a short of 2 months or so, depending on how much radiation, 2 to 3 months I could be done. 2021 will be the end.
Oh, Kathy. You're so good.
I know. I wasn't entirely expecting, because those 2 spots of enhancement.
I was worried about that. I was a little, not worried, I was
No,
concerned.
it was in my mind, and then I was okay, the muscle was sticking where the tumor was. Does that mean it got into my chest wall? But all of it came back.
Wow.
Yep.
That
Yeah.
is just the most wonderful news we've had this year.
I know.